All right, good afternoon, everyone. My name is Eric Ekholm, and I'm presenting on behalf of the VCU School of Education team. We actually have folks from VCU, VDOE, Chesterfield County, and Harrisonburg City. So let's get right into it. So our approach is we know that there's a ton of data available related to risk factors and outcomes for COVID. And so we really wanted to think about how to make this data more digestible and more usable. So what we did is we wanted to see if there were distinct profiles of localities in Virginia that demonstrated similarities across different measures of risk. Then we wanted to see if those profiles exist, to what extent do they differ in their number of cases and deaths related to COVID. We think this approach allows us to simultaneously capture the complex interactions among the variables we include in our profile analysis, while also simplifying the representation of those interactions to just the profile membership variable. It also allows us to recommend place-based interventions rather than variable-based interventions, which we think is really important for actually getting them implemented. So the data we used was from the Health Opportunity Index, the Social Vulnerability Index, the QWI, population estimates from the Census Bureau, and the cumulative COVID cases and deaths from VDH. So the first step was to estimate the number of profiles. So we used latent profile analysis, which attempts to find hidden groups of observations, in this case localities, within the full sample of data. And after fitting our model, our statistics suggested that 4 profiles fit our data best. So that's what we moved forward with, and that's what you see here. So you see for each variable that we use to determine profile membership, you see the score, the average score within that profile on that variable as represented by these bar charts. You also see the red lines indicate the grand mean score on that variable. So you can see how each profile scores relative to the total mean. And you can also compare across bars to compare scores between profiles. So next, after estimating this, we can also look at these on the map. I think the key takeaway here is that although there's some similarities in geography, geography is clearly not the defining factor, right? You see kind of profile membership all over the place kind of for all of them, which really indicates that there are similarities that we might not otherwise think of. So after we fit the profile models, we want to see if they were differently predictive of the number of COVID cases and deaths in the locality. So to do that, we ran a regression model where we first scaled cases and deaths relative to the total population of the locality. And we also included population density as a covariate in this model, right? Because we know being close to other people is a key factor for transmitting COVID. And so, in short, we did find some differences in terms of number of cases. We found that groups 3 and groups 1 were at risk for kind of more COVID cases per person than the other profiles. And in terms of deaths, we found that group 3 was at considerably higher risk for more deaths relative to the other groups. And so when we kind of revisit that previous map, here's how that shakes out. We see profile 1, which again was just higher risk for cases, are these kind of geographically smaller but not necessarily less populated places scattered throughout the state. And for profile 3, again, increased risk of cases and deaths per person are these blue localities. And again, we see spread out across the state with some clustering in south, southwest, but we also see like Portsmouth, we see Page County, we see Accomack, places that you wouldn't kind of at first blush think are similar, but do kind of show similar patterns and as predictive results here. So key takeaways here, we found there are 4 distinct profiles of localities when we used health, social vulnerability, and employment data to try to group them. We found that those profiles were differentially associated with COVID cases and deaths after controlling for population density, with profiles 1 and 3 being kind of the most vulnerable there. The results of this analysis suggest that there are geographical areas that are right for targeted intervention above and beyond what we're currently doing. And if we were to move forward with this, the next step would be to work with people who know more about disease than we do to develop interventions that are most useful for those folks. So thank you all. We're out of time. I really appreciate it, and take care.